Remember the pandemic? Well, praise the Lord. Some rare good news coming from the lips of President Joe Biden, and not even read from a television prompter. Check out this zinger from the leader of the free world.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
He said it twice, but as tends to happen with Biden, his team came in to clear up his mess and clarify that it's complicated. So are we back to the old normal now, or are we in the new normal, or the new old normal? Meanwhile, the UK didn't seem to get the memo, because we've got communist professor and independent stage scientist Susan Michie propagandizing on Twitter, claiming that July and August saw over 10,000 COVID deaths. 10,000 COVID deaths. Is that true? We'll find out in just a moment. And Germany seem to have doubled down on the new normal and are actually bringing back COVID restrictions from October the 1st. Germany there reacquainting themselves with tyrannical authoritarianism. Old habits die hard. So is the pandemic over, or should we brace ourselves for a winter of restrictions? Let's speak to the stat man himself, former statistician at the Office for National Statistics, Jamie Jenkins. Hi, Jamie.
Hi, Mark. You good?
Really well. It was refreshing to hear the president say that, because he's been the most hawkish when it comes to lockdowns, mask mandates and vaccine tyranny.
Yeah, and I think Joe Biden's probably had the COVID more times than most people in the world as well, Mark, as well. I think he kind of caught it, didn't he? And then he caught it again, or tested positive a couple of weeks later. So I think the question is, the pandemic over? So remember, a pandemic, that stage is where you're kind of panicking because a virus is spreading quite rapidly across the world from country to country. And it's quite clear we're way past that now. So the pandemic is over, I would say. The World Health Organization were talking about this a few weeks ago, that we're moving to the end state. Obviously, COVID's not over. COVID isn't going to go away. But what the endemic state is, which is beyond the pandemic, Mark, is that you kind of get to where we are with flu, where you're kind of looking at the elderly, the people with chronic conditions, people with concern for those. But remember, this time last year, we were heading into that period around Christmas time where Boris Johnson was saying, let's boost everybody down to the age of 18. But even governments across the world now are rowing back on those policies, and they're focusing vaccinations then on people who are more vulnerable with chronic conditions. So, but Joe Biden's saying, Mark, the pandemic is over. But just so recently, Djokovic, he was fine to come to the UK to win the Wimbledon title, but he was banned from the US because they still have these rather bonkers rules where some countries you can go in if you're not vaccinated, other countries you can't, and the US haven't changed that policy yet.
That's right. It feels more like politics than public health now, doesn't it?
It does, and it's a bit of it's a bit of a lottery in terms of where you go. You talk of New Zealand and Australia, some of the most restrictive nations across the pandemic. You can go in if you're unvaccinated now. Spain this week have said that they're getting rid of this form that you have to fill in if you're unvaccinated or you haven't had 3 jabs. But they've said that if you haven't had 3 vaccines, you've still got to prove a negative test. Or if you've had a second vaccine, you have to have it in the last 270 days. So Spain haven't got rid of things this week for kind of unvaccinated or only double vaccinated Brits. The Netherlands have got rid of things this week. It seems to be a bit of bingo in terms of where we are. And if we were following the science, Mark, you know me, I'm a data's man. If you're looking at the data, people who are unvaccinated or have had 3 vaccines, the chance of most people in the UK now testing positive for COVID is pretty much the same, whether or not you've had 3 vaccines or whether or not you're unvaccinated, because most people who have had those 3 vaccines was such a long time ago. You do get a temporary benefit for about a month or so. But I think the main problem you've got, Mark, is that they're not following the science now. As you say, a lot of it's political, and people are scratching their heads thinking, what data are you looking at? Because there's no data to justify one country taking away restrictions and another country continuing with them.
Yes, with Denmark now only vaccinating the over 50s, that's as clear a sign as you'll need that we're through the worst of this.
And the UK is going pretty much in the same position as well, Mark, because, you look at the flu vaccine, you would normally allow people to have the flu vaccine over 50. Denmark are still allowing the vaccination for younger people with those chronic conditions and the most vulnerable. But, we were only talking about a year ago, Mark, where we were having all these vaccine mandates, remember, going around where you had to show your vaccination status to go into a pub. They said you had to have them to go into the nightclubs, then they closed the nightclubs because that didn't work. There's been a huge public policy failure with the handling of the vaccination rollout with regards to vaccine mandates. And I think the governments are learning now in terms of the mistakes of the past. So we don't think we're going to be going down that in the future. Thankfully, Mark, that's a good thing.
This sunny outlook has been contradicted by behavioural scientist and independent SAGE member Susan Michie, a well-publicised member of the Communist Party, who claims that July and August saw over 10,000 COVID deaths. Is that true?
Well, no, it's not true, Mark, because what she's quoting there is a tweet that's been put out by somebody. And I think people can remember those stats we were seeing through the pandemic every day on the news, on the BBC ITV, which was how many deaths were in 28 days of a positive COVID test. Now, early on in the pandemic, it was a reasonable marker in terms of where we are. But when Omicron hit, what that meant is so many people have got infected that loads of people have tested positive, and loads of elderly people tested positive when they went into hospital, not even going in for COVID. So the statistic she's quoting there, Mark, is how many people have died in July and August within 60 days, not 28 days, 60 days of a positive test. You know, and experts, not just myself in terms of looking at this, have said absolute nonsense in terms of where we are. The true figure of COVID deaths, because the pandemic, probably in that overstage, but people are still dying from it, is more than half of that. Now, communism, Mark, which you talked about with Susan Michie, China, communism, lockdown. She's quite keen on lockdown. She was in a TV interview on Channel 5, I think, saying that we should have social distancing and masks forever. As far as I'm concerned, Susan Michie shouldn't be anywhere near anything to do with public health policy. And just for your viewers, she's actually been appointed to lead one of the World Health Organization's behavioral groups, I think, as well. So an absolute kind of, I want to be polite in terms of what I say, but I wouldn't be in terms of bringing her forward for any public health policies, Mark.
And I thought the Germans were clever. They're very good at engineering. They make great cars and dishwashers. Why are they signing up to more COVID madness? They've already agreed to have mask mandates and potential lockdowns going into the winter. Do you think there'll be an outlier?
I think so, Mark. There's definitely no appetite in the UK for this. We've got our new Prime Minister, Liz Truss, has said she wouldn't reintroduce these. You've still got people pushing for it. We're coming into October now, Mark, and every year before the pandemic, you know, your viewers and people listening on the radio, go and Google it. If you look at NHS crisis before the pandemic, you get to this point where you get the NHS bosses calling for alarm and panic. Now, the NHS is in a pretty poor state at the moment. It has been through the summer. We're seeing more non-COVID deaths than what you'd expect for the time of year. So we are going to be in for a difficult winter. But I think the Germans, Mark, have probably got more to worry about the lack of gas and keeping the heating and the lights on than they have from COVID this Christmas. So I think they want to be focusing on that part of public policy, not starting to think about reintroducing policies around masks and the like across Germany, across the country there.
Well, speaking of gas, you've been on fire tonight. Jamie, thank you so much. I know that you'll be joining Mark Stein in a week's time for your regular slot. There you go, Jamie Jenkins, the independent statistician and political commentator, a man who crunches the numbers so you don't have to.